us today for Stand Up with AI. This week, as we celebrate International IPC Week, we're showcasing how AI-powered tools like Blue Mirror are transforming infection prevention education. We're helping healthcare teams work smarter, safer, and more confidently with PPE and hand hygiene. In today's session, we'll explore how Blue Mirror is being used across the globe to build consistent, effective IPC practices, moving beyond compliance and creating a true culture of safety. You'll see practical strategies and ways your team can leverage AI to strengthen infection prevention every day. A little bit of housekeeping before we dive in. Today's session will run for about 30 minutes, followed by some time for some Q&A at the end. You'll all be on mute during the presentation, but if you're having trouble hearing us, just try exiting and rejoining. That usually does the trick. Today's session, feel free to pop your questions in the chat at any time. We'll be keeping an eye on it and we'll answer as we go or at the end. And yes, this webinar is being recorded. We'll send out a replay to all registrants in the next few days, and it will also be available on our website. We have quite a full agenda today, so here's a quick look at what we'll be covering. A brief intro to our speakers, going over the training challenges, an overview of Blue Mirror, Honour Health's journey with Blue Mirror, results from some Blue Mirror training, improving life through AI, and some new modules that are coming through, and finally some time for your questions. So a little bit about me. I've been working in healthcare for over 15 years across primary, secondary and urgent care settings. I've held various leadership roles, including practice management and recently as a national quality manager. My passion has always been about improving patient outcomes and supporting people who deliver care every day. I know how challenging this work can be and how crucial it is to have the right tools and systems in place to help teams succeed. Also on the webinar with me today, I have Romy Noons, our founder and CEO of Blue Mirror. Romy is a computer engineer and lifelong AI enthusiast who found his true calling in healthcare. Romy combines deep technical expertise with a passion for infection prevention, dedicating his work to transforming how healthcare workers and trained infection prevention skills. His mission is clear: to ensure that every healthcare professional, regardless of location or role, has access to high quality practical IPC training, giving them competence and confidence needed to prevent infections and raise the standards of care. We also have Jeannie. She is the founder and principal of Innisea Global, a health IT consulting and authorised reseller firm that helps companies expand globally through strategic sales and business development services. With over 15 years of experience in healthcare, Jeannie has led successful market entries and growth initiatives across North America, Europe, the Middle East, including UAE, Asia, Australia, and New Zealand. Under her leadership, Innisea Global serves as a US authorised reseller for Blue Mirror. I'd also like to introduce two people from Honour Health who you get to hear from later in the webinar. Crystal Robinson is a seasoned healthcare leader with over 15 years of experience in infection prevention and control. She currently serves as the Associate Vice President of Infection Prevention and Health Equity at Honour Health. Crystal has led infection prevention programs across a wide range of care settings, including acute care hospitals, long-term facilities, ambulatory surgery centres, outpatient clinics, food banks affiliated with hospital systems, and both paediatric and adult care centres. Her expertise spans diverse healthcare environments, reflecting her commitment to patient safety and public health. She holds a Certified Master of Public Health and is certified in Infection Control CIC. She actively contributes to the field through national leadership. Crystal co-chairs the EPIC Health Equity Committee and serves on the board of ELAINE, the SDOH, a Phoenix-based non-profit organisation focused on reducing transportation barriers and connecting community members to healthcare and other essential services that impact overall health and wellness. And also from Honour Health, we have Martin. He is a certified infection preventionist with 3 years of experience supporting healthcare safety and quality across 3 hospital campuses, serving diverse populations. He holds a Master of Public Health and certifications in AIPC, CIC, and CHIPPB. Martin leads campus improvement projects and works closely with interdisciplinary teams to strengthen infection prevention strategies and promote patient safety. In addition to his infection prevention work, Martin serves on the board of APIC Grand Canyon chapter as both the nominating and awards committee member and social media administrator. Through these roles, he supports professional development, recognition, and community engagement within the infection prevention field. Most organisations have some form of training that begins with over the past few years, we have had so many conversations with many healthcare organisations, from large hospitals, multi-site aged care facilities, small aged care facilities, small and large private hospitals. And while every facility is unique, the training challenges that we hear about across the globe are surprisingly familiar. We've listed some of them here. I don't have enough staff and my team is overworked. We face geographical barriers and it's hard to deliver training to everyone. Connectivity issues in remote and sometimes in metro areas as well. And staff turnover can be a real challenge. Most organisations have some form of training that begins with an induction or orientation. This is sometimes one-on-one or face-to-face with an educator, but it's often online. And the reason why it's online is because it's accessible and scalable. We then enter the day-to-day BAU. Protocols don't necessarily change often, but there is a chance of outbreaks requiring enhanced PPE use. We then move down the track, and it's really shocking to know that so many healthcare workers are not confident in PPE donning and doffing techniques. Studies show that this is the case, even in places where PPE use is a regular occurrence. With hand hygiene, people often think that they're doing well, but the audit results often tell a different story. Clearly, something in the process needs to shift. Further in the webinar, we will talk about this a little bit more, showing results before and after, particularly with hand hygiene training that we've been doing over the last couple of weeks. Now, this is really important. It's not that people aren't trying. It's the systems that we use to train and support them that don't always work. We rely on posters, PowerPoints, and train the trainer models. These tools do have value, but then we enter what we jokingly call the black box of hope. We hope that training is consistent, we hope that the training sticks, and we hope that staff feel confident. But hope is not a strategy. And most of the time, we only realise something is broken or when something goes wrong. So let's take a quick break from talking and show you a short 2-minute demo video of Blue Mirror in action. What you will see is a sample donning demonstration with prompts and feedback. But remember, everything is fully customizable to match your organisation's specific protocols.
Please show your hand to choose a protocol. Welcome. Our hands have the power to heal or harm. The outcome depends on how we choose to use them.
A patient is in contact precautions, requiring you to wear gloves and a gown when interacting with the patient. On your morning rounds, you notice the patient is coughing, and they report to you they've been feeling unwell overnight with a fever and vomiting. What PPE precautions should you take with the patient? Correct.
Perform hand hygiene. Done. Put on gown. Ensure neck and sides are secured. The neck of your gown seems loose. Turn around and please wait, I will check the back of your gown. Checking back of gown. Gown open at back. Please face the screen again and review the back of your gown. Turn around and please wait, I will check the back of your gown. Checking back of gown. Please face the screen again and review the back of your gown. Done. Put on your mask. Mold the nose piece. Base of mask under chin. Done. Put on gloves. Cover the cuff. Show your hands upright when done. Checking wrists. Your left wrist doesn't seem covered. Your right wrist doesn't seem covered. Done. You're all set.
All right. Now that you've seen Bloomer in action, let's unpack what is happening behind the scenes. It uses computer vision AI to see and respond to your movements. There's no facial recognition, no recording or storing of videos, and all statistical data stays local. Prompts, both visual and audio, are customized to reflect your facility's protocols. The setup is a collaborative process. We work with you to get it just right and support you as you roll it out. It works on a variety of devices, iPads, Surface Pros, desktops with a webcam, laptops, and we can provide a full list of these. As you saw in the video, Bloomer will teach your staff how to don and doff PPE correctly. It provides you with instant and in-the-moment feedback. Whether someone's gown is not on correctly, their hand hygiene is too short, or their gloves aren't fitted properly, Bloomer will pick it up immediately and guide them to correct it. This kind of real-time correction makes learning quite powerful and memorable, and it sticks. We understand that protocols need to be customizable to align with your organisation, but how do you address the training requirements of different roles? With our role-based protocols, you can set specific protocols to train groups in the way they need to be trained. For non-clinical staff, you can have protocols that cover off the training requirements with more layman terminology, less clinical language. And for your clinical staff, you can have a robust PPE and hand hygiene program, which highlights and assesses the principles of IPC, as well as the techniques required to don and doff and complete hand hygiene safely. As you can see here in the image with our SteriMat PPE training station, you have a completely mobile PPE and hand hygiene training solution on wheels, which can be used for practical training, competency assessments, and even stationed in specific units to support your organisation during an outbreak. If you do have an outbreak of a particular illness, you can set up an outbreak protocol and deploy that very quickly to all of the devices that are set up for Bloomer, requiring individuals to retrain in that particular protocol for the illness that is a current outbreak. We also include scenario-based questions to help bridge that gap between theory and practical. You can create your own scenarios and tailor them to suit different departments or different roles. Staff select from multiple choice answers and receive instant feedback, helping them to build confidence and reinforce that knowledge in real time. The feedback that we have had from a lot of staff using this is that it really, really builds their confidence and retains that information from their training sessions with having these real life clinical scenarios being put into the training as well. Consolidating theory works best and goes hand in hand combined with practical assessment. Switching to audit mode, you can assess staff without any instructional prompts, simulating sort of real world conditions. At the end of the assessment, you'll receive a detailed report showing the outcomes, along with prompts to either retry the assessment or undertake training again. This ensures your receivers receive the real-time feedback, helping to reinforce learning and highlight areas for improvement. Let's talk about what's happening behind the scenes. This is the admin console, which is a little bit of the unsung hero of Bloomer. It's packed with features to make managing training a lot easier, from scheduling training and tracking training, and also to reporting. You get a clear view of how training is going across your organisation and the tools to tweak and improve as needed. You can also integrate it with your learning management system, and it's scalable from large networks to small networks. We're built to integrate, and we have several options for this. And finally, recognise the efforts of your team members with full certification management. With Blue Mirror, reporting is quite simple, but yet very powerful. You can run reports on all statistical information across roles, individual employees, and training activity. With the compliance reports, you can identify compliance percentage breakdown per department and/or role. Also identify top training areas and to determine if there is more training that is required. The statistical reports giving you clear visibility of training completion, performance, and compliance levels. With the audit trail, it provides a detailed record of who completed what training and when, ensuring accountability and compliance with regulatory standards. These reports make it easy to track progress, identify gaps, and demonstrate compliance during audits. I'd now like to hand over to Crystal and Martin from Honour Health to present on their experience with Blue Mirror.
Good morning, everyone, and thank you for allowing us to talk to you all about our experience with Blue Mirror. And so jumping right in, we performed this pilot, and we took a very methodical approach on setting up the pilot for Blue Mirror, incorporating both change management and process improvement principles. Our goal was not only to evaluate whether the solution works and whether it's user-friendly, but also to understand its broader impact, specifically how it could transform our PPE and hand hygiene training. We also aim to lay the foundation for a business case that would demonstrate the value of this technology to our infection prevention program and overall patient safety. Blue Mirror, we went through very rigorous planning phase with multidisciplinary staff. So of course with the Blue Mirror team, our internal IT team, clinical educators, operational leaders, our infection preventionists, and any other stakeholders identified. And together we defined the pilot setup and identified gaps that we hope to address. Before launching, we focused heavily on quality assurance. We conducted several show and tell sessions to walk through the process internally before putting it into place. Let me see. So we had to procure tablets, protective accessories for the tablets, and ensure proper power supply and connectivity before deploying across departments. And as expected, we encountered some early challenges. Artificial intelligence is still a relatively new concept in healthcare, and while there was excitement, there was also curiosity, hesitancy, and skepticism. We addressed those concerns by being transparent, inclusive, and making sure staff were part of the process from the beginning. Logistical challenges also arose, especially in a large facility. We had connectivity issues. We had to figure out how to manage logins and determining the level of integration that we would apply for the pilot. And since this was a pilot, we were very intentional about balancing innovation and operational feasibility.
Chloe, can you advance the next 2 slides, please? So how we put Blue Mirror to work on our applications all with a pilot at our Scottsdale Osborne campus, and the focus was on onboarding new hires. We wanted to see how AI-based training stacked up against traditional methods. We split the group into 2 cohorts. One group went through training followed by an AI assessment. The other was trained by a human preceptor and assessed using AI. This gave us a great side-by-side comparison. One of the most impactful outcomes was the time saved. Traditional human-led training took around 15 minutes per person, while AI assistant sessions brought that down to just 10 minutes. That kind of efficiency makes a big difference when you're onboarding large groups of staff. But it wasn't just about speed. We saw some real efficacy gains too. We had no need to pull trainers off. The system tracked everything automatically. Staff could train when it worked for them in the language they preferred and at their own pace. And because it's available 24/7, it fits into all kinds of schedules. We did run some early statistical analysis, and the results showed that AI training wasn't just comparable, it was potentially better than human-led sessions, which was a big win for us. When you consider features like immersive learning, consistent delivery, multi-language support, and built-in analytics, it becomes clear that it just isn't a new tool, it's a more of a modern, scalable approach to infection prevention training. Next slide. So after seeing how Blue Mirror performed in a real-world setting, we started to notice some consistent patterns, things that work well, and areas where we can refine our approach. That led to some valuable insights we think are worth sharing, especially with teams considering the rollout. One of the biggest wins was how immersive the training felt. It really boosted retention. Staff were more engaged and they remembered what they learned, which is always a challenge with training. Another thing that stood out, staff really appreciated the control over their training. They could complete it whenever it fits into their schedule, whether they're in a private office, break room, or even a common area. That kind of flexibility really changed how they approach the learning process. So if you're considering rolling this out, here are some things we suggest. Start small, let's use the waters, gather feedback, and adjust before going big. Get your frontline staff involved early. Their buy-in is crucial, and they often have insights that leadership like this. Make sure your IT team is ready. Tech kickoffs can derail our momentum, so having strong support upfront is key. And finally, use the data. The analytics for AI training gives a clear picture of what's working and where you need to improve. It's not just about checking the boxes, it's also about continuous improvement. So overall, it's been a learning journey, but that's one that's really big. Next slide.
All right, and so to wrap us up, throughout this process, we've grown increasingly excited about the potential of this technology, not just as a tool for infection prevention, but also as a broader solution for staff and patient safety. We see tremendous value in using Blue Mirror AI as an augmentation to human-led training, and in some cases, even as a replacement. And there are some clear benefits. One, standardization. Training is delivered consistently each time, eliminating variability that can occur when human preceptors due to competing priorities or differences in teaching styles. Also, it offers objectivity. The system removes human judgment, which can be prone to error. There's scalability, as mentioned, in situations like the COVID pandemic or facility outbreaks. We can rapidly train staff on current PPE protocols and even unique sequences, or trying to heighten precautions for high consequence pathogens. And again, it's accessible 24/7 in multiple languages and allows users to learn at their own pace. And it's fully customizable. Every aspect of the training and the assessment experience can be tailored to align with the organization's policies and the needs of the population being trained. We've considered some additional use cases for this technology, which include, like I said, emergency preparedness and pandemic response, just-in-time training for PPE and outbreaks, supporting IT teams when they have high demands in other areas to expand capacity, visitor training to increase capacity where other times might not be prioritized, looking at central line insertion and maintenance practices, sterile compounding and clean room compliance, and then cross-departmental training for areas like EVS, food services, and administrative staff. It's been a pleasure to become familiar with this technology and see how it can support our system. Our experience was very promising, and so is our early statistical analysis. And more importantly, it's given us a glimpse into the future of AI applications in infection prevention beyond chart review optimization or decision-making logic. And thank you for allowing us to share our experience.
Thank you so much, Crystal and Martin. We can have some questions and discussion now. If anyone has any questions, feel free to pop them in the chat. There'll also be the question and answer time at the end of the webinar, so we can cover off if there are any specific questions for Crystal and Martin. We can answer them then as well. So thank you so much. Just check. Haven't got anything yet. What I'll do is we'll move on and again put those questions in the chat and we can answer them at the end of the webinar. I'll pass over now to Romy, who is going to have a chat about some results that we've been doing recently with Blue Mirror.
Thank you very much, Chloe. Hi, everyone. I'm Romy Nunes, CEO and founder of Blue Mirror. And look, Blue Mirror has been tested by our customers in all types of ways that you can imagine. You have seen some of the results from Crystal and Martin at Honor Health, and those are amazing results. And I find it especially important, this comparison of the competency that people achieve when using Blue Mirror when compared to the competency that they achieve when being trained by humans, and the results are simply fantastic. Here is a simple example of a end user survey applied to people after using Blue Mirror. And this is a very typical result. In the coming slides, you see a number of other results that are very consistent. Essentially, everywhere we go, across multiple countries, multiple continents, different settings of care, the results are always very, very consistent. There is people absolutely love this interaction, and you will get something like 95% of people saying I strongly agree and or agree that I would feel comfortable using the system, that it was easy to use, and that the training would help improve my technique. I found that it is amazing how simple the interaction is at the end of the day. When people are faced with this completely new type of technology, and I've realized that everyone has been trained on how to use Blue Mirror by the fairy tales. Everyone knows how to interact with a talking mirror. So it becomes very, very natural. And because of the language, the verbal instructions and that real-time feedback, we see a lot of people talking back to the system as if it were a person in front of them. So it feels very, very natural to everyone. In the next slide, we have a example result of a practical assessment of hand hygiene in this case, performed before training with Blue Mirror and after training with Blue Mirror. So very consistently, we will see that pretty much every healthcare worker will perform the palm-to-palm technique with correct technique and for the minimum duration expected. But for all other techniques, the results may vary considerably. In some cases, less than 10% of people will be performing a particular type of technique. So there is a gap of knowledge and competency on how to really apply the different techniques for hand hygiene. After a training session with Blue Mirror, then if you repeat a competency assessment, it doesn't get perfect, but you can see that there is a huge improvement on how many people are capable of completing with accurate technique and for the minimum duration of time, all of those techniques. These types of results are very similar to PPE and hand hygiene, and again, very much repeatable everywhere you go. With PP, a amazing study that was done at the NHS in England, they've measured the competency of the average NHS worker when donning and doffing PPE. Then they delivered one training session with Blue Mirror, and then they came back later and measured competency again. And the results were absolutely fantastic. So on the doffing, for instance, people would be making an average of 56% of the steps wrong. Wrong in the sense of making at least one mistake that could lead to contamination. But after Blue Mirror, that dropped to only 9%. So went from 56 to 91% of accuracy in the process, which is also a very powerful result. Next slide. This very similarly shows, in this case, how many of the techniques people can recollect. And very often you see out of the 6 WHO recommended techniques, for instance, people will be able to perform a couple, usually palm to palm and 1 second that they can remember. And again, after practical assessment, people will be able to perform usually about 4 of them, and they may still fall short on time for a couple of the techniques. But it is, again, a huge improvement. Next slide. So here is, well, we try to put some of the logos of who is using, so just you can see a variety of organizations from different places of the world, of different sizes and shapes and different types of healthcare services provided. We couldn't fit them all in here, but we've brought a number of them just so you can see, and you probably recognize quite a few of those, as in most of the countries that we go, the people that get into Blue Mirror first are usually very renowned infection prevention leaders, key opinion leaders, and organizations that do very well with their infection prevention practices. Next slide. You have seen a video of PPE training. We've also mentioned quite a bit about hand hygiene training. Both training of hand hygiene and PPE work in a very similar way. You're in front of a talking mirror, guides you, you can see yourself, and that's very powerful. You can see the mistakes you have just made. The system points out to you, then asks you to repeat, and you are able to complete the task successfully. It also takes away all of the pressure of having an expert in front of you. In this case, it's just a machine. It also removes the pushbacks, which is fascinating, but people do not push back into Blue Mirror. They just follow its prompts and go through it. But Blue Mirror also, and Chloe mentioned this very well when showing you the web management console. Because it's capturing data automatically, it becomes a very powerful tool for you to analyze how your training is done, how the competency of people are going. Through these scenario-based questions, you can identify gaps of knowledge, and you use those insights that Blue Mirror brings you to update the training sequences and also to plan your other interventions in a way that you can improve on those gaps that have been highlighted. So it is a real complete system in closing that loop. It also allows you to deliver role-based training in the sense of, if you're training people from clinical backgrounds on, say, hand hygiene, you may go straight into the technique and just deliver the refresher of techniques so they can be reminded and be on top of the game. If you're training someone without that clinical background, you may want to deliver additional bits of theory about the chain of infection, about how germs spread, about why this is so important. Because a lot of people involved in the infection prevention efforts inside a large organization will lack the background to understand a whole lot of those aspects. So you can deliver essentially the same training, but with this special tailoring, depending on your department, depending on your role, and so on. Next slide. Some of the things that are coming soon. So ASAP's technique currently being used by a selected group of partners that are the clinical partner in the equation of a technical clinical partnership, in this case with Blue Mirror. So they been using the system, sharing their feedback, helping us improve the user experience, the message delivered, and also the AI systems that support the process. Manual handling of patients, fit testing, and there's a whole lot more coming. We have frequent requests to have something special around the bare below elbow, which the system already does, but especially around nail varnish and long artificial nails. And yeah, there's so much more. Our dream is that this system will become a simulation room in your pocket, and you can just pop up your tablet, your laptop, anywhere, and get a real-world simulation training of essential infection prevention skills. Next.
Thanks, Romy.
Thank you.
That's a wrap on the presentation side of things. And so now we would really love to hear from you. If you have any questions for us here at Blue Mirror, if you have any questions for Honor Health, please put them in the chat. We would love to hear from them. You can send them privately or you can send them to the whole group. We have one question, Romy. I can answer this question. How much time and resource are typically required to implement Blue Mirror in a facility? This really depends on the size of your facility. We do have a couple of package options that come with sort of a plug and play type option with that SteriMat unit that comes with an iPad. That's quite quick. For more larger complex organizations, we work with you to set up the protocols, and this can happen quite quickly, but generally, including training sessions, this takes about 1 week. Another question here, can we customize the training content in the scenarios to reflect our internal protocols, or do we have to adopt yours? That's absolutely correct. You can customize them to align with your protocols. We're not in the business of telling people what their protocols should be and how they should be done. We get you to tell us what your protocols are, what your SOPs are, and what your quality improvement plans are, and we work with you to implement that. Any other questions come through?
I may mention a common question I hear from people outside of Australia when they see the demonstration with an Australian accent. You can choose which language and which accent the mirror plays. So if you are in a different region of the world, you have a very regionalized voice as well available to you.
That's great. If you do have any further questions, feel free to email hello@bluemirror.ai and we will respond to your questions. Again, this webinar is recorded, so it's going to go up on our website and we'll send a copy out. So if you're re-watching the webinar and you think of some questions, feel free to send us an email and we will come straight back to you. There will be a short survey following the webinar, and we would greatly appreciate if you could take a couple of moments to complete that as well. Otherwise, that is it. Thank you very much, everyone, for your time. Thank you very much to Romy and Jeannie and Honour Health for presenting. It's fantastic to see you guys doing such amazing work, and we look forward to keep seeing those results. Thanks, everyone.